This next segment, I would like to introduce you to our guest speaker, Dr. Ghossein. Dr. Ghossein is a professor of medicine in the Division of Nephrology at Northwestern, Feinberg School of Medicine. She is the Associate Chief of Nephrology and the Vice Chair of Medicine for Academic Affairs. Dr. Ghossein is also the Director of the Transition Care Program at Lourdes Children's Hospital for young adults with kidney disease transitioning from pediatric to adult care. Thank you so much, Dr. Ghossein, and welcome. So the stage is yours.
Great. Well, thank you so much, Matteo, and thank you for inviting me to speak today. I'm going to try to share my screen and see if that works. Oops, so we're already at the thank you. So let me, here we go. Okay, so as Matteo mentioned, I am Cybele Ghossein, and I run a pediatric to adult transition program at Lourdes Children's, and that's what I'm going to be speaking to you about today. I do have slides, but at any point, if you want to stop and just chat, I'm happy to do that as well. So the goals today is to review the scope of the problem of transition of care, to understand the challenges that chronically ill young adults face, and discuss some of the goals and barriers to an effective transition from pediatric to adult care, and discuss some ways that parents and caretakers can help with this. So as a mom myself, I'll just say that all children grow up way too fast, and growing up is really very tough. And it's even harder for those with chronic illnesses. And I want you to try to remember what it was like to be a teen or a young adult. I know it's a time that I would not want to go back to, but you know, young adults are just trying to figure themselves out. They're trying to develop their own personalities. They may take extra risk. They're developing their own creativity. Their friends are very important. Academic challenges are quite frustrating sometimes. And trying to think about what they're going to do next in life is also an added pressure. And we call this time emerging adulthood. It's the ages between 18 and 25. And as I mentioned, it's a big time of change where you're moving from high school to college or employment. You're moving away maybe from family. There are changes in friendships and relationships. And it's an emotionally really intense time period. It also happens to be the peak time of risk-taking behavior. And why is that? Well, the brain development is an ongoing process. It starts around in childhood, but it continues through young adulthood. And the last part of the brain to develop is the prefrontal cortex. That's the part in the front of our brain that is responsible for assessing risk, decision-making behavior, and behavior control. So adolescents are more likely to engage in risky behavior and less likely to consider the consequences of their action. And it really is not their fault. It's biology. So as frustrating as it is as a parent to say, why can't you just X? Sometimes they just can't control it because it is part of normal brain development. So that's for even young adults without chronic illnesses. But now we add an added pressure to this young adulthood stage, and that is chronic illness. And 500,000 young adults with chronic illness will transition from pediatric to adult care every year. And for young adults with kidney disease, the added pressures include strict medical regimens, dietary restrictions. They might have to leave school for medical appointments. There are medications that may affect their physical appearance, and they may be more physically restricted than their peers. And I heard some of the young adults with kidney disease speak a little earlier, and they mentioned some of these struggles. And because of the brain development and the risky behavior that occurs, this time period is really, the patients are at higher risk for complications. So we know that for type 1 diabetics, for example, this age group is at higher risk for diabetic complications. There's a higher risk for unplanned hospitalizations in this age group, no matter what the underlying disease is. There's a higher risk for kidney graft failure in our transplant patients. There's a higher risk for med non-adherence for young adults not taking their medications. And this is what we as parents and as physicians are most concerned about, all of these potential complications. But what are the adolescent patient concerned about? They're really not concerned about this. They're concerned about their peer group, their appearance, their social interactions, the development of relationships, their aspirations regarding their future. They're physically mature, but yet they're not emotionally mature. And so this is why we need to help them during this time of transition. So what is the current state of transition of care between pediatric and adult healthcare? So typically what happens is one day you're seen by your pediatric specialist. The next appointment, you're told that you need to see an adult provider. You're given a name and number, and you're asked to go ahead and call for an appointment. And the following appointment is with the adult provider that you're not familiar with. And that could be very anxiety provoking for a lot of patients that are used to seeing their pediatrician and their pediatric specialists for a long time. And we all know that the kind of care delivery between the pediatric practices and the adult practices are very different. In the pediatric space, the provider and the parent help control the healthcare. It's often a multidisciplinary team where you may have a nurse practitioner, a physician, nurses, a social worker that helps support the patient and the family. And there's a lot of family support, not just patient support. But on the adult side, that often does not happen. We expect the patient to be responsible for all their appointments and their medications. There may be multiple providers that are associated with the care of the patient. They're all very separate, and you have to go and seek them out and make appointments yourself as an adult. There's definitely less social work support, and there's absolutely very little support for the parent. So it's a big shock to transition from pediatrics to adult care. On top of it, just the physical space is different. You know, when you think about what a waiting room for a pediatric practice is like, it's bright, there's full of colors, there are crayons and other fun things to do. It's almost like a happy place, but that's not what a patient will see in a waiting room in the adult care setting. And that can, again, be very anxiety provoking for a new young adult that's coming into the adult healthcare practice. On top of it, I always say, and it's so true, that pediatricians are just nicer people. They're very engaging and happy. And, you know, often the adult care provider doesn't really know how to interact with this age group very well. And for parents and caretakers, there are a lot of things that are very different for you as well. It's a scary time for parents. They slowly have to let go of the child. They have to let go of the pediatric practice that they know so well. And that's anxiety provoking. That loss of control is very anxiety provoking. The other thing that's very difficult and unsettling is in the pediatric practice, the pediatrician, the pediatric nephrologist communicates directly with the parent. But on the adult side, no, the communication is with the patient, and parents are not called, or the communication is not directly with them unless the patient, the child, says that it's okay. And so that's very different, and again, can be very unsettling. So I think I've laid out sort of the stress of time of young adulthood and what the difficulties with the transition process. So how could we make this process easier? Well, actually, there's national guidelines about how to transition effectively. And I know this is a busy slide, but I'll try to talk you through it. So the national guidelines say that between the age of 12 and 14, you as a parent and the child as a patient, as well as the pediatrician, should start discussing what the transition policy for that practice is. What do I mean by that? I mean that you should start to understand when the pediatric specialist is going to transition you to adult care. And that's different for every practice. There are some practices where at 18, you're done. There are others at 21, and then you have to transition. And then there's some practices where they wait until the patient's ready. So you should know what the policy is between the age of 12 and 20 and 14 so that you can get ready. And then between 14 and 18, there are lots of stages where the patient, the parent, and the pediatrician should start to assess the skills needed for transitioning, which I'll talk about in a minute. They start to prepare the patient to transition. And then between 14 and 18, they should develop the plan of where the patient will be going. Between 18 and 21, they should start to integrate the adult practitioner into the care by sending over medical records and talking with the adult practitioner so they know that they expect this patient. And then after the transition, the adult practitioner should then tell the pediatric practitioner that things have transitioned fine and the patient is okay. This is the ideal setting. And again, they're based on national guidelines. I did mention that there were some skills that every patient should have before they transition to adult care. And these are the skills, the competencies. I understand my condition and can describe it to others. I know my medication and what they're for. I can make decisions for myself about my treatment. I know what the adult clinic arrangements are and who will be reviewing me in clinic. I know how to make my appointments. I can make my own transport arrangements to get to the hospital for appointments. I know who to call in a medical emergency. I'm able to talk about my worries concerning blood tests and other treatments. I know the dietary advice that I have to follow and the importance of activity. I have appropriate knowledge about sexual health matters. I have discussed alcohol, smoking, and drug issues. So you as a parent or caretaker can start helping your child learn some of these skills and competencies before they transition to adult care. So what makes an effective transition? Well, I think flexible timing is very important. Every child is different. I've seen some patients ready to transition at 17 and others that are still struggling at the age of 22. Obviously, support from the patient, they're ready to go, as well as support from the provider and family is very important. A multidisciplinary transition program between the pediatrician and the adult, I think, is ideal. Adult nephrologists that are comfortable with managing not just the disease. You'll find quite a few nephrologists that can manage kidney disease, but it's also managing the age group that's very important because this is an age group that requires a lot of time and attention. And then ongoing support for the patient after the transition process. These, I think, all make for an effective transition. And there have been studies that have looked at how often this happens. And this comes from a study where 200 young adults with chronic medical problems, not just kidney problems, they responded to surveys regarding their transition from pediatric to adult care. Over 65% had never had a discussion about transitioning to adult care. Over 65% never had a discussion regarding maybe insurance changes that might occur when they become adults. Greater than 45% had never had discussion regarding changing healthcare needs as they grow up. But the patients who had transition care readiness were more confident and ready to transition than those who got no preparation. So clearly, this is an important part of switching to adult care is getting the proper transition readiness. There are lots of different models of how one can transition from pediatric to adult care. There could be an adult specialist as part of the pediatric team and that sees the patient in the pediatric space. And that's what I do. And I'll talk a little bit about our program in a minute. There are some practices that have a patient navigator, like a nurse that helps the patient with the transition. There are more and more specialists that are called med-ped specialists. They're boarded in both medicine, adult medicine and pediatrics. And so they are a very important part of transitioning. And I've even seen web-based transition programs. So all the skills, competencies, the tours of the new adult practices are so we talked about some of the ways and the needs of an effective transition. What are some of the barriers? Well, having no transition program at all is a big barrier. Having no adult nephrologist that is identified to take on the care. A poor understanding of adolescence by the adult provider can be quite a barrier to an effective transition. Obviously, patient anxiety and family anxiety can be a barrier. A lack of communication between the pediatrics and adult providers. And then another one that is often very difficult is that there could be insurance differences between the pediatric and the adult providers. So you can have one pediatric practice that takes the insurance, and then you want to transition to an adult provider that does not. So that can be a barrier as well. So I wanted in the next few minutes to talk to you about our program. And I am very lucky to practice right across the street from Lurie Children's Hospital. And that's where I run the transition program for young adults with kidney disease. And I do that about once a month. And what happens is prior to the clinic date, the pediatric team decides what patients are ready to transition. These are patients that they've been caring for a long time. They've gotten to the right age group, about 18 to 21, and they've already felt that they're mature enough to transition to adult care. And so they make their appointments for the transition clinic over in the pediatric space. And then they send me the summaries of all the patients that I'm going to see on that particular day. They send them to me ahead of time so I get to know the medical history. On the day of clinic, which usually takes place about once a month or once every other month, I go over with my physician assistant and sometimes a social worker, and we go over to Lurie, over to the nephrology clinic space. And right before the clinic starts, we sit down with the pediatric team. I say sometimes with food, but unfortunately with COVID, that we no longer can do that. But we review the patients that are set for clinic for that day. And then the adult team actually sees the patient. Pediatric team is there for what we call a social handoff. They may come in and say, hey, Johnny, how are you doing? Is everything okay? Or you've met your new doctor, great, and they will leave. They don't really participate in the appointment, but they are there in case we need for them to answer any questions. And then we also use this opportunity to review past patients that have gone through the transition so that we can let the pediatric team know how they're doing. So what's the actual appointment like? Well, my PA and my social worker will go in and do what we call the transition assessment. And that's a review of those skills that I mentioned. Does the patient know their medication? Do they know what their disease is called? Do they make their own refills? They call for their own refills. Just get a general sense of whether they're ready to come into the adult care space. They also assess for high-risk behavior, and that's something that the pediatric team helps us with. Is this a patient that we're worried about substance abuse or non-compliance with medication? We also, at that time, will also do an insurance assessment just to make sure that we are able to take the insurance. And if not, we make adjustments so that we are able to transition them effectively. And then I will go in and I'll do a medical assessment. And I also discuss the care differences between pediatric and adult side. So that way you can get the patient accustomed to what it will be like. We explain the transition process, how to contact us. We give them a map of the campus and where their appointment's going to be. We tell them what to expect on their first adult visit. We try to always have at least 10 minutes where we ask the patient's families to step out if they've come with families, so that we can allow the patient to ask questions independent of anybody, of any family members in the room. And then right before they leave, we give them an appointment. We don't ask them to make their appointment. We give them a time and date so that they know exactly when they're going to see us again. And then they come across the street at Northwestern for their first adult visit. And we try to see all the patients, the young adult patients, on a separate day. And that's so that we can give them extra time. These patients need a bit of more time so they can get accustomed to the space and get accustomed to us. And so we do that. They see both the same PA and the same physician in clinic. So they've already met us, and so they can identify us. We introduce them to the clinic. And then after the appointment, we give them a very short-term follow-up. And what do I mean by that? There may be patients I only need to see once every 6 months, maybe even once a year, but we don't leave them with a follow-up that long because we're worried that they won't feel attached to our practice if we let them go for that long. So we'll give them another follow-up in a month or two. And that might just be a social visit, but that way they get used to the process of coming back and seeing us in the adult space. For many patients, we become their medical home, and that means that they will call us for referrals for questions that have nothing to do with their kidney health. They may need a dermatologist, they may need an allergist, and they will use us. And we are okay with that because we want them to feel connected to the practice. And that way we know that they will stay connected, to Northwestern. So during the appointments, we try really hard to enhance the adherence of these patients. This is, as mentioned before, it's a difficult time, and we want to make sure that they feel that they can trust us. And maintaining trust and an open partnership is one of the most important things for allowing the patient, the adolescent patient, to get the most out of their medical care. We try to establish very small and realistic goals. I may say, okay, let's see if you could just take your medication, for a week every day. And then we try to, move that up to 2 weeks or 3 weeks or, every day for a month. We just work with them in small steps. When possible, we try to give them choices. And, sometimes it may be that it doesn't really matter whether they take this high blood pressure pill or that high blood pressure pill. So we try to ask them, have you had an experience with either one of these medications? Did you have a side effect? That way they feel like they have a little bit more control. We try to keep the adolescent schedule in mind. And this always reminds me that I once had a patient who I gave him a noon appointment, and he didn't show up. So I called him and I said, hey, why didn't you show up to your appointment? And he told me he had overslept, and the appointment was at noon. So I try to make all these appointments in the afternoon so that they can sleep. We try to simplify prescriptions. We repeat instructions. We have the patient repeat instructions so we know they understand. And if we know that there's going to be really a very complex regimen of pills, we don't give it to them all at once. We try one step at a time so that they can get used to the process. And then we try to help them with reminders, whether that be phone reminders or pill boxes. And both, I heard that today with some of the young adults that were on the program earlier, that they use those types of reminders so that they can remember to take their pills. So how could you help as family and caretakers? Well, helping them work towards medical independence. Try just starting by having them order the refills. You know, the Walgreens app is pretty simple to download, and you know, having them be in charge of that, reminding them is fine, but letting them be the one to refill their medications. Having them start making appointments and putting the appointments on their own calendar so they remember. Ensuring that they have time alone with their provider. If the provider doesn't ask that you step out, I would say that you should offer that so they have time to talk about whatever their fears, their anxieties, they may not necessarily be comfortable talking about with the family in the room. Start discussing transition early and start reviewing some of those healthcare competencies that we mentioned earlier. Allow them to take the lead in discussing their care with their provider. It may be fine as they get a little older to say, hey, you know, why don't you go ahead and start and telling the doctor how you feel or what questions you may have. Allow them some space and time to be teenagers, obviously within reason. And then decide what's not negotiable and try to let go of the rest. And this is very hard, I think, but diet, for example, is a good example. I see lots of parents be quite concerned about diet, as well as they should, but maybe that should take, you know, a back seat, maybe to taking the medicine. And you know, whatever choices the patient and the parents make, just trying to give them a little space to just be, you know, young adults, I think is important. So in conclusion, I think what we've discussed today is that, you know, young adulthood is a high risk time, especially for patients with chronic illnesses, and transitioning from pediatric to adult care really comes at a very vulnerable time. So it's very important to support the patient as much as we can. Transition requires a comprehensive approach that includes patient, families, both the pediatric and the adult provider. And so I will end there and thank you, and I'm happy to answer any questions if you should have any.
Thank you so much, Dr. Ghossein. That was very informative. And what I like about this topic is that it can be applied to anyone and everyone transitioning from pediatric to adult care. So thank you so much for joining us. I don't see any questions, but yes, thank you so much for joining us today. It was wonderful to have you.
Well, thank you.
Enjoy your
Bye-bye.
weekend.
Thanks.